Coronavirus. In our representation, we talk about of the coronavirus. Coronavirus is kind of the common virus that causes infection in your nose, sinus, or upper throat. Most of coronavirus aren't dangerous. Early in 2020, after December in 2019 outbreak in China, the World Health Organization identified SARS-CoV-2 or the new type of coronavirus. The outbreak quickly spread around the world. Symptom of the coronavirus. The main symptom of the coronavirus is fever, coughing, shortness of the breath, trouble breathing, fatigue, chill, and sometimes with shaking. Body ache, headache, sore throat, congestion or runny nose, loss of the smell or taste, nausea, and diarrhea. This is the main symptom of the coronavirus. The virus can lead to the pneumonia, respiratory failure, heart problem, liver problem, and septic shock, and maybe death. Many COVID-19 complications may be caused by the condition known cytokines releasing syndrome or cytokine syndrome. This is when infection target your immunity system to flood your bloodstream with an inflammatory protein called cytokine. They can kill tissue and damage your organ. If you notice the following several symptoms in yourself or loved one, get medical help right away. If we see trouble breathing or shortness of the breath, chest pain or pressure, new confusion, can't wake up fully, and bluish of lip and face. According to the researcher in China, these were the most common symptoms among people who have COVID-19: fever 99% of patients, fatigue 70%, coughing 59%, lack of appetite 40%, body ache 35%, shortness of the breath 31%, and mucus or balgam 27% of the patient. What to do if you think you have it? The first thing, if you don't feel well, stay at home. Even if you have mild symptoms like headache and runny nose, some fever, stay until you are better. This lets doctor focus on the people who are more seriously ill and protect healthcare worker people you may meeting along the way. Try to stay in the separated room away from the other people in your home and use separated bathroom if you can. Second one, call the doctor if you have trouble breathing. Coronavirus risk factor. Anyone can get COVID-19 and most infections are mild. The older people, you are high risk of the severe illness to the coronavirus. You also have higher chance of seriously illness if you have one of these health condition: chronic kidney disease, chronic obstructive pulmonary disease, it's called COPD, weakness of the immunity system because organ transplant, obesity, serious heart conditions such as heart failure, coronary artery disease, sickle cell disease, and type 2 diabetes mellitus. Conditions that can lead to the severe coronavirus illness include moderate to the severe asthma, disease that affect in your blood vessels or blood flow in your brain, cystic fibrosis, high blood pressure, weakness of the immunity system, dementia, liver disease, pregnancy, damage in the lung tissue, pulmonary fibrosis, smoking, thalassemia, and type 1 diabetes mellitus. Coronavirus treatment. There are no specific treatment for coronavirus. People who get a mild case need care to is either symptom like rest, fluid, and fever control. Take over the counter medicine for sore throat, body ache, or fever, but don't give aspirin to the child or younger than 90 years old. You might have heard that you shouldn't take ibuprofen for treatment of the coronavirus symptom, but you naturally in situation of the health says people who have virus can use non-steroid anti-inflammatory drug like paracetamol or acetaminophen as usual to use. Antibiotic won't help because they treat bacteria, no virus. If you hear people who give antibiotic with COVID-19 or coronavirus, getting antibiotic, it's for infection that come along with disease. Antiviral medication remdesivir is the first medication to get FDA approval for a treatment of patient hospitalization with COVID-19. Originally developed to the treatment of the Ebola, evidence show that those treatment with remdesivir recovery is about 11 day compared to the 50-day for those treated with placebo. Thank you very much about this video. Give me like and subscribe. Goodbye.